Well, it is Wellness Wednesday, and Dr. Alllan Grill, the Chief of Family Medicine at Markham-Stouffville Hospital, is joining us, and we're talking about measles cases. We've heard about, outbreaks around the world. We've heard the warning, of course, from the Ontario Chief Medical Officer of Health last week, so we thought it'd be a good time to talk even more about measles cases.
Yeah, last count of 4 cases, I believe, in Canada, and it's, in young people who have traveled abroad. Dr. Grill, I think we should go back to basics. What is measles, and what are the consequences associated with it?
For sure, and good morning to both of you. So measles is a virus that causes infections and makes people feel sick. The symptoms, we talk about people having one or more of the 3 C's. So it's cough, coryza, which is just a fancy term for runny nose, and conjunctivitis, where you get red, watery eyes. That's followed by fever and this characteristic red, blotchy rash that starts in the face and spreads down throughout the body. Once people get symptoms, they're sick for about 10 days, and most people actually fully recover. The problem is, measles can be associated with some very serious consequences. So you can get bad ear infections, and people can actually have hearing loss. You can get really sick with pneumonia. You can get something called encephalitis, which is inflammation of the brain. It can cause brain damage.
Oh my gosh.
If you're pregnant, you're at high risk for miscarriages or what we call preterm or early labor. And in some cases, people can die of measles, specifically children under age 5 or those with compromised immune systems. And the last thing people really need to know about measles is it is super contagious. So it's spread through airborne droplets. So if somebody's infected in their room with a bunch of people, high risk that those people will get infected.
So what's happening, Dr. Grill? Why are we seeing more cases lately? And are you seeing more in your practice at Markham-Stouffville Hospital? Is this something you're actually experiencing?
Yeah. So right now we're lucky that we've only seen, across sort of Canada, we've only seen about 10 cases since January. But compared to last year, the cases are up.
Right.
What's happening is, in 1998, Canada was actually declared that measles was eliminated. In other words, it's not endemic, it's not circulating regularly in this country. And that's because most Canadians are either protected from natural immunity, so if you were born before 1970, you were probably exposed, or you're protected from vaccination. So after 1970, people got 1 dose of the measles vaccine, or what we call MMR. It's actually measles, mumps, rubella in 1 needle. If you were born after 1996, you got 2 shots, and that's infants at 12 months of age, and then a second dose when you're a child between ages 4 and 6. So we know that immunization works. The problem is, during COVID-19, a lot of people, including children, fell behind on their vaccines. They stayed home, they weren't going to see their doctor. And also, if you're not immunized or you're not fully immunized, and you travel to a country where measles is circulating, you can get exposed. Or those same people could get exposed if someone from one of those countries comes to Canada. It's called an imported case, right? And then when those Canadians get sick, because it's so contagious, they spread it to others, and you get these little outbreaks we're hearing about in the news. So the best thing you can do to protect yourself is know your immunization status. And if you're not sure that you're fully immunized, especially if you're about to go travel, and March break is coming up, people love to travel, go see your primary care provider, like your family doctor, and find out if you need to get a booster because you need to get caught up.
Yeah, it sounds like protection is vital here to make sure, because as you said, with the travel and people coming here, you just really can't control that. So what should people do if they find out that, hey, they have been exposed to someone with measles?
Yeah. Oh, and by the way, I haven't seen any cases in my office yet. I know you asked that before. So the last point is, if you're fully immunized and then you find out you were exposed to someone with measles, it's really a watch and wait. So you monitor for symptoms. The symptoms could start anytime between 10 and 21 days after that exposure. Now, if you're fully immunized and you come down with symptoms, best thing to do is self-isolate, put on a mask, especially if you're living in a household with other people, because it's so contagious. And you have to do that until at least 4 days after you develop that characteristic red rash, because at that point, you're not considered contagious anymore. And if you're going to go see your doctor, call ahead, because your doctor doesn't want you sitting in the waiting room exposing to other people. They'll get you in, put you in an exam room right away, kind of sneak you out the back door. If you're not immunized or not fully immunized and you get exposed, you should actually seek medical attention from your primary care provider right away before symptoms develop, because within 72 hours of that exposure, you might be eligible for a shot of the measles, mumps, rubella vaccine. And in some cases, if you're really at high risk for complications like compromised immune system or an infant under 12 months who hasn't been vaccinated, if you present within 6 days of the exposure, so before you get symptoms, you might actually be eligible for a shot of antibodies, or what we call immunoglobulin. So it gets into your system and actually protects you against symptoms developing from that exposure.
That's pretty good. And you just said, doctor, you haven't seen any cases at your practice, but one of our team members was with the doctors yesterday, overheard the doctors talking about parental concern coming in, worrying that they may have been exposed or may have measles. Are you seeing much of that concern about people worry, just like, well, I'm hearing about it, now I'm coming in, do I have it? And obviously finding out not. Like, what's the level you're hearing or seeing?
Yeah, so we're seeing a lot of patients coming in and they sort of ask, either not necessarily that they've been exposed, but they'll ask questions like, I've been reading in the paper, like measles, aren't people immunized, what's going on? And then it's a great opportunity for the family doctor or the nurse practitioner to look at their chart and say, so when were you born, first of all?
Yeah.
And depending on when you were born, did you have your full immunization schedule? And if you're not sure, it's never unsafe to give an extra dose. So when we're unsure if our patient's fully immunized, we just give them a dose of the measles, mumps, rubella. Even if, let's say, they are fully immunized, but they just can't remember, it's never unsafe to give them an extra dose. It's done all the time.
And very quickly, how long does it take to kick in, the vaccination?
Oh, the vaccine to kick in. Yeah. I mean, usually, so the advice that they talk about people who are about to travel, they say to get it 2 weeks before. So in general, it's about 2 weeks before it kicks in.
Okay, wow. So much helpful information. I learned so much more from our discussion. So thank you so much for bringing it, Dr. Grill. Appreciate it.
We always appreciate the conversations.
Thank
That
you.
is Wellness Wednesday.